Welcome back to CBS 19 News at 6:30. A first-of-its-kind nursing program has a powerful history, one built on strength and determination. The program at Virginia's Hampton University paved the way for students to break barriers in healthcare and beyond. Danielle Seda shares how the legacy continues to inspire future generations.
There are many ways to describe a nurse: selfless, compassionate, committed, a bedside angel for the seriously sick. But if we were to pull back the curtain on the history of Hampton University's nursing program, one word that would best describe these men and women who served during a time of divide would be resilience.
There were not a lot of African American nurses at all, particularly in the South. And so the education to start a program to provide care for African American families, it was almost very, very spiritual.
Dr. Danita Potter is a professor and the dean of nursing for the school's nursing program. In 1891, it was the first HBCU program to train nurses of color. But before it was established, Potter says healthcare for African Americans was hard to come by.
People were not only ignored, they died from disease and famine as a result of not being able to go into hospitals. So death rates were enormous. And so it's very important that we understand that history. That was the purpose of starting the nursing program.
But this good work put in by these nurses didn't come without its challenges. The school is the site of the original Dixie Hospital, where in the 1960s, 3 nurses known as the Dixie Three fought against racial segregation and were fired for sitting at the whites-only cafeteria.
Our students really appreciate that history, and they understand it because the majority of our students are minority, and so we pride ourselves to make sure they understand that history, and then we make sure we embody it.
Senior Gabriella Christmas says she was inspired to wear white by her grandmother, who was also a nurse.
She made a lot of reforms at the hospital that she worked at in terms of advocating for the other black nurses and black faculty members that worked there.
She can't wait to be part of the legacy of nurses who fought for and provided better health care in their communities.
I've learned that you have to advocate for yourself in all senses, especially as a black nurse, especially as a black female in the world. It's really important to stand up for what you know is right.
The past is prologue. It has prepared us to be who we are today.
In Hampton, Danielle Seda.
Bringing